Hi guys, today in this video I will show you how chemical peel work and who is a candidate before and after care, what kind of chemical peel are using, how the procedure work, and what kind of benefits it has on your skin, everything you need to know and everything in between. So keep watching. Today we'll be talking about everything you need to know about chemical peel. What is the benefit of chemical peel? Most people heard of chemical peel, but sometimes they still don't understand what is that used for. Chemical peel can be used for acne control, acne scars, wrinkles, age spot, fine lines, hyperpigmentation, skin dullness, precancerous, lighter complexion, melasma, sun damaged, uneven skin tone, and rosacea. There's 3 levels of peel: light, medium, and deep. Light, you can get it done all year round, is safe and gentle. Medium peel, you can use it towards cooler weather season, such as spring or fall. It's a little bit deeper than light and depends on the weather where you reside. Some people could get hyperpigmentation if you don't wear SPF or hat. Deep peel is the strongest peel of all, and you must be very careful when you get it done. It's best to get it done by a professional, or you might risk a chance of burning your skin, causing scars, hyperpigmentation. I don't recommend the deep peel. It's harsh on your skin. You have to prepare for a week or more downtime, and your baby's skin might get hyperpigmentation from the hot and cold weather. TCA is my favorite. I use light TCA for a weekly peel. It's gentle and I can use it all year round. Glycolic acids derived from sugarcane. It can add into your moisturizer for skin exfoliation and also for acne control. It's not strong as TCA or salicylic acid, but it's stronger than lactic acid. The third one is lactic acid. It's the mildest peel out of this list. I use it sometimes on face masks, on facials. It's gentle. It gives the face a beautiful glow for the first few days. The peel might start about 3 to 5 days, or sometimes it's not even peel at all. Salicylic acid is very popular amongst the cosmetic industry. It's best to use on oily skin. Sometimes you can add them into your face wash to control acne, or shampoos to control dandruffs, or you can add them into the toner to bring down your pH. Here and there. But what are the chemical peels made of? TCA, chlorination of acetic acid, or chloroacetic acid. The glycolic acid is pretty simple. They're made from sugarcane. Lactic acid made from milk. Salicylic acid made from bark of willow tree. Mandelic acid are made from bitter almond. Important notes before chemical peel: do's and don't. For a better result, you can use product that contains vitamin A, glycolic acid, salicylic acid, lactic acid before chemical peel for at least a few weeks. Over-the-counter products, you can stop using it 3 to 4 days before your appointment. Prescription products such as Retin-A, Renova, Tazoric, stop 7 days before chemical appointment. You can resume your routine back 1 week after the light and medium peel, or a month and over for a deep peel. Stop electrolysis and any type of laser treatment to the area 2 to 4 weeks before or 2 to 4 weeks after your peel, as instructed by your esthetician. Do not suntan or use tanning beds for 2 to 4 weeks prior to or 2 to 4 weeks after your treatment. Stop any type of waxing or waxing cream to the area 2 weeks prior to or 2 weeks after. No laser treatment or any kind before the peel or at least 1 week. For the best result, you can get microdermabrasion or nanoneedling or some physical exfoliation 1 week before the chemical peel for an even and deeper result. Contradiction to all chemical peels. You might not be a candidate if you have herpes simplex, if you are using Accutane in the last 6 months, if you are now pregnant, think you might be pregnant, or are trying to become pregnant, if you form keloid or hypertrophic scars, if you have history of sun allergies, prior bad reaction to the peel, recent radiation treatment or cancer, sunburn or significant sun exposure in the last few days, surgeries or cryosurgery within the last month to the area that you plan to have peel, allergic to resorcinol, allergies to salicylic acids, blood vessel disease, diabetes, inflammation, irritation, infection of the skin, influenza, chickenpox, kidney or liver disease. Aftercare post-treatment do's and don't. When cleansing, do not scrub. Use gentle cleanser. No harsh chemical or wash with warm water. Face wash should not contain any acid types or it might irritate your skin. With any peel, your skin might start to peel 3 to 4 days after the peel and continue to peel for 2 to 5 days. However, it is also possible that your skin might not peel at all depending on your skin type, peel strength, and the product used before chemical peel. Do not peel, pick, or scratch the area, as this might result in scarring. Apply healing cream or hyaluronic acid to speed up the healing process, as many times as needed per day, or gentle moisturizer. Do not have any other facial treatments for at least 7 days to 2 weeks after you peel or until your skin is healed and back to normal. Depending on the types of peel, light peel 1 week, medium 10 to 14 days, deep peel 21 days and more. Always wear your sunscreen. Apply a sunscreen at least SPF 30 every morning, or wear a hat to protect your face from the sun. Extreme hot or cold weather can also cause your skin to burn if you have a medium peel or deep peel. This is the few questions my clients usually ask. How often can I get another chemical peel? I said, light peel, it will be 7 to 10 days. Medium peel will be 2 weeks or more. Deep peel will be 8 weeks or more. What is the best product to use? Products that contains hyaluronic acid or pure hyaluronic acid. I just want to remind you all that hyaluronic acid is not quite an acid. They just name them like that, but they're not burning at all. It's super gentle and it helps to heal the skin. and also vitamin E or something mild without acid such as salicylic acid, glycolic acid, or retinol. Your skin needs to heal. We needed to give it time to do so. You can resume using these products after 1 to 2 weeks after the peel. Hyaluronic acid is highly recommended because it used to speeding up the healing process and increase collagen production. This is my setup. It's a light TCA plus a few drops of 25% in there. And then this one is just water. I'm adding a little baking soda in there just so it helps to calming down and neutralizing out the acid later. And first thing you need to do is wash your face with soap and water. When you use a brush, making sure that not too wet to where it's dripping all over your face. And if you want to make sure when you do it on your forehead, you can use a little bit of the sponge. So in case it drips on your face, you can put the sponge right on the bottom of your eyes so that way it doesn't drip in your eyes. Also, you can use a fan. A fan will be your best friend because the burning sensation might be uncomfortable. So during the time that you were waiting for 3 to 5 minutes, it will be wise to have a fan so it makes you feel comfortable for the rest of the waiting time. Apply multiple layers into your skin so the chemical peel will penetrate into your skin way better. Sometimes I put 2 to 3 layers and then wait for about 3 to 5 minutes. But if you want to wait a little longer, you can too as well. Then you set the timer for 3 minutes. Okay, after 3 minutes, you're gonna get the water and baking soda and neutralizing out the chemical. Then you wipe your face with water and then dry it out and then add some moisturizer on it. I made this moisturizer and it has vitamin E, hyaluronic acid, green tea. It just helps the healing. And I also made this airbrush spray. It made from zinc and mica for SPF. So this is my skin right now. Start peeling. This is the 4th day. Right there. And right here. Like that. This part is not peeling yet. So these are the flakes. I'm doing this more for a demonstration purposes, so people can see what kind of peel they're getting themselves done. So I do it on my arms because I do not want to put this on my face. It's just too strong, and this is in the middle of summer and it's really not safe for my face. So I just do this in my elbow, and I can wear long sleeve to cover it for a few days. And as you see, the peel is very strong and it peels off piece by piece. Most people like it, but at the same time, it's not healthy for my skin to expose to any sun at all for a month or so. Otherwise, it will get darker and have pigmentation problem.
Which have to charge their car.
All right, so now I'm going to just show you a few examples of the product. So, for example, if you were looking for a product, you're always looking in the back and see what the ingredients they have. Like aloe vera is great for chemical peel, hyaluronic acid is great for chemical peel. There's green tea, all this, hemp oil, sweet almond oil. There's nothing in here that it says contradicting with the list before, like glycolic acid, retinol, or any type of other acids. Hyaluronic acid is great for your skin, so these will be acceptable for your after skincare. Pure hyaluronic acid is always the go-to. If it's easier, you can find it anywhere in all these, literally even the grocery store probably now will have it, or CVS, or just literally anywhere. They should have just the pure version. So what you can see in the ingredients is distilled water and hyaluronic acid and a little bit glycerin or something. That's mine. So anyway, go to. When you start looking at moisturizer, they probably have more complicating stuff in there. And if you're starting to see things in here that you don't quite understand much, but this one is like mostly natural stuff. So things that you can understand. And also says on here, hyaluronic acid somewhere in the middle of the ingredients, right there. Hyaluronic acid is it usually depends on how concentrated it is. If it's powder version, then it will be down in the bottom. If it's diluted version, you'll see it on the top. This one is a diluted version right here. As you see, hyaluronic acid is diluted out, so into the liquid version before I'm making this actually. So it's more complicating when you see a lot more ingredients, but if you start seeing a lot of ingredients you don't understand, stay away from it. It's all chemicals. But if things that you can understand, like 90% of it you can understand, stick with it. And this is the one that I'm more important. I'm going to show you. Anytime that you start seeing products that has anything would help with zit, acne, or dark spots, that's the stuff that you want to stay away just for a week. I'm not saying that you need to stay away forever. It's just while you're having you need some time to heal. So in here, like you see, there's aloe vera, hyaluronic acid, glycolic acid. That's the thing that is like red flag just while you're healing. That's all. So you cannot use this during the peel because your skin needs some downtime to heal. So we want to avoid glycolic acid. Collagen is great for you. And then panthenol, sweet almond oil, everything else is good, except there's another one is retinol. Retinol is using for controlling acne and also lighten skin. So anything that has to do with lightened skin or controlling acne, like glycolic acid in here and retinol, are the two ingredients that you don't want to use during the peel. But you can definitely use those type of ingredients before the peel. So if you want to have a good result, you want to use this product that contains glycolic acid, retinol, or lactic acid, some kind of acids like that. Is actually helps with
there's so many different types of acids that should able to help you with skin exfoliation. So and then you can stop for a few days before the peel. If you were using this product, you want to stop for a few days before you're getting a peel, so that way your skin won't get overly sensitive. And also if you were using this product before the peel, it will help to the chemical peel to penetrate into your skin better. So, and you can resume it after 1 week. When you're done with the peel, you can resume using this product.
On the product side of things, you might want to look into something that is mild and light, vitamin E, or something like coconut oil, shea butter. It's also doable, but on the deep side of the peel, you might want to go with hyaluronic acid, because it's one of the miracle product that I love to use for any time that I have any skin irritation. I use it. And also I will have a different videos. I will show you what to look for in an ingredients of products that is harming you, and which one is good for you, which one is you should stay away from. So that will be in a different videos later when I have the time. But for now, thank you. Hi guys, thank you for watching, and I hope that you guys get some insight of how chemical peel work and able to incorporate into your skin routine. It's one of the most wonderful thing and super fast to do. So you can get into a salon and get it done in no time at all. So there's another tip: if you decided to do this yourself, making sure that you want to start with light peel first, and you want to have 1 bottle of light peel and 1 bottle of heavy peel, deep peel, and then you just starting out with a light peel and see how it reacts on your skin. Then after that, you can start putting a few drops at a time, and deep peel into the light peel, and gradually increasing the dose as you go, so that way you have the chance to see how it reacts, and it will be much more gentle, and your skin probably will get used to it by then, so it's not going to be too harsh on your skin. Again, stay light to medium, but do not going any deeper, because sometimes it's not really healthy for your skin to going deep on the deeper peel. So thank you for watching again, and please check out the other videos.